Good morning, everyone. We are going to go ahead and get started. We want to thank you so much for joining us this morning for the last day of our National Consumer Protections Week. It's been a great week of sharing information from different resources, giving us information on how to protect ourselves as consumers, how to protect ourselves and our loved ones. My name is Dorian Dodson. I'm from the Texas Senior Medicare Patrol. Let's see. The Texas Senior Medicare Patrol, we are, in case you have not heard it or have not been to our other presentations this week, we are a federally funded program. There's one of us in every state. Our particular office covers all of Texas. We recruit and train volunteers, professionals, and all about Medicare fraud and abuse. We also report intentional fraud and abuse to Medicare fraud control units. This is our mission. The SMP mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. And if you're interested in volunteering, please contact me. Again, my name is Dorian Dodson. I'm the volunteer coordinator here at SMP. We want you to join the patrol. Why would you join the patrol? You can help protect your community. That's why. You can help future Medicare recipients. We want the Medicare program to be around a lot longer. And so you can also meet other volunteers while doing so, while having fun, while sharing information that can help protect your community and your loved ones. Here is our hotline here at the Texas SMP. You can give us a call here if you suspect that you have a case of Medicare fraud. If you're not sure, you think there might be something, feel free to give us a call. You will always receive, we'll reach a live person through that. We answer the calls and you won't receive an automated tree or something like that. So give us a call. And I would like to introduce our speakers for today. From the VA Office of Inspector General, we have Special Agent Letitia R. Cleveland and Kudarat Bamadele, also known as Booming. They're from the VA Office of Inspector General. They're going to provide us today with some great information to help you protect yourself as a consumer, and also the information that you've received either this week or today. Share that information with other people you think might benefit from that information as well. Knowledge is power, and the more that we share, we can help empower others around us to help protect themselves. So Letitia, I'm going to give the controls over to you if you would like to share your screen so that you can proceed with providing this information.
Great, thank you, Dorian. Can you let me know if you can see my screen?
Yes, I can see your, wait a minute, hold on a second. Oh, this isn't your screen. Stop sharing. Okay.
Here we go.
Yes, I see your screen now.
We're good to go. Thank you. Good morning, everyone. As mentioned, I'm Letitia Cleveland, and I'm the Special Agent in charge for the VA OIG's Healthcare Fraud Division. I first want to thank the Texas Senior Medicare Patrol for inviting my team and I to be a part of your event today. And I also want to thank you all for joining us this morning. We are so grateful for this opportunity to share information about our agency, the work that we do at VA OIG, and in particular, to share information about our Fraud Indicators Toolkit, as well as some recent fraud alerts that we have released that specifically impact the veteran community, but are also applicable to everyone. Just to tell you a little bit more about myself, prior to joining the VA, I served another federal agency, Health and Human Services, which oversees the Medicare and Medicaid programs. While with HHS, I conducted and later supervised healthcare fraud investigations for several years. Most recently in all 4 judicial districts here within the state of Texas, as I managed investigative staff across the state. My work it has resulted in numerous successful administrative proceedings, civil settlements, and criminal convictions, and over 80 million in restitution to the Medicare and Medicaid programs. Of note in regards to my work here in Texas is one of my investigations that actually led to the largest Medicaid provider attendance services case charged in Texas history. And I'm proud to say that I believe that record still holds to this day. Since transitioning to VA OIG back in August of 2021, I have overseen the development of proactive fraud identification tools, our healthcare fraud investigation training program, and I've also built an interdisciplinary team to combat fraud within the VA's healthcare delivery programs. A member of my team, RN Bumi Bamadeli, is co-presenting with me today, and I'd like to allow her the opportunity to introduce herself. Bumi?
Thank you, Letitia. Good morning, everyone. Thank you for having us here today. My name is Bumi Bamidele, Nurse Consultant for Healthcare Fraud Division at the San Antonio Resident Agency location. I'm a certified professional coder and a certified risk adjustment coder. I'm a highly skilled clinician with 15 years of nursing experience, spanning case management, care coordination, utilization management, coding consultation, and provision of direct care in different nursing specialties. Before joining VA OIG, I was a senior clinical coding nurse consultant for multiple private healthcare companies. In those roles, I was responsible for ensuring compliance with risk adjustment coding per Center for Medicare and Medicaid Services guidelines, and also ensuring services rendered were necessary and appropriate for all Medicare beneficiaries. In my current role within the VA OIG, I provide support for agents in regards to medical coding inquiries to prevent fraud, waste, and abuse. Thank you.
Thank you, Bumi. Now, the VA, we're actually the second largest federal agency, and we have specific missions to support the over 19.5 million men and women that have served this country and their family members. When most people think of the VA, the first thing that comes to mind is our healthcare facilities. And that's understandable as we manage the largest integrated healthcare system in the country under our Veterans Health Administration, which consists of about 145 hospitals, about 1,200 community-based clinics, and relatively recently, we have embarked on contracting with community-based providers to ensure that our veterans have access to the healthcare services they've earned through our community care program, which is operated in the same way as the Medicare and other federally funded healthcare delivery programs. The VA also operates about 56 benefits offices across the country that assist service members as they transition out of military service in the areas such as education, home loans, life insurance, and so much more. I'm proud to say that my husband is a Navy veteran, and my family has certainly benefited from a lot of these benefits programs. Lastly, and certainly no less important, the VA also maintains about 135 national cemeteries that are focused on making sure that the sacrifice of those that have served this nation is never forgotten. Now, Office of Inspector General, you've heard us use that term. What exactly does that mean? An Office of Inspector General is basically a generic term that's used to identify the oversight division within a state or federal agency. Like nearly all federal inspector generals, the IG, or Inspector General for the Department of Veterans Affairs, is a presidentially appointed position. We are currently under the leadership of the Honorable IG Michael Missel and his deputy David Case. The mission for us here at VA OIG is to serve both the veterans and the public by conducting meaningful independent oversight of the department.
To support our mission in the VA OIG, we consist of 5 directorates with shared values and this include Office of Audit and Evaluation, Special Reviews, Healthcare Inspection, Management and Administration, which oversees VA OIG Fraud, Waste and Abuse Hotline, and the directorate at which our division falls under, Office of Investigation.
Now, the types of investigations that are conducted by our VA OIG special agents, they focus on a wide range of crimes that impact our programs and our operations. They include fraud in the areas of healthcare, procurement, benefits, construction, and other fraud, cyber crimes, drug offenses, and unfortunately, some violent crimes that occur on our VA campuses. And we also investigate serious standards of conduct violations committed by high-ranking VA employees. Another area where we focus our efforts is on pursuing a large number of civil qui tam actions. Qui tam actions are civil cases that are initiated by private parties on behalf of the United States. For qui tam actions, the private parties or relators or whistleblowers, as they're referred to, they share in the government's recovery of ill-gotten funds.
Office of Investigation is divided into 7 investigative regions. Investigative operations for each investigative region are overseen by special agents in charge, like Ms. Letitia Cleveland that is presenting with me today, and their leadership team of resident agents in charge of 38 field offices throughout the country. Texas falls under the jurisdiction of South Central Region under the leadership of acting SAC Patrick Roche. We have offices in Dallas, Houston, and San Antonio. I am currently located in San Antonio, Texas, while Ms. Letitia is located in Dallas, Texas. In addition to special agents, the field offices are staffed by investigative supportive personnel that aid our effort. The field investigative operations are further augmented by our headquarters division, such as our division, which is the healthcare fraud division.
Combating healthcare fraud has been identified as one of the highest priorities for us here at VA OIG. To that end, the mission of the VA's Healthcare Fraud Division is to identify and investigate potential crimes and civil false claims that impact the VA's healthcare programs. We do that through proactive initiatives, data analytics and modeling, subject matter expertise, joint and parallel enforcement actions, and by building external partnerships. Our VA OIG special agents, they're experts at detecting and investigating healthcare fraud within our complex and diverse healthcare system. The Healthcare Fraud Division was developed specifically to strengthen their efforts. We do that by developing data-driven investigations that are based on persistent and emerging fraud trends and outlier providers that warrant further investigation by our field investigative staff. We also provide investigative tools and resources to our staff and facilitate training on topics such as the varying VA healthcare delivery programs, our reimbursement processes, data analytic and investigative tools, and general healthcare fraud investigation techniques. Although we are technically a headquarters division, the Healthcare Fraud Division here at VA OIG is unique in structure in that none of us are stationed at our headquarters in Washington, D.C. Instead, we're stationed in the field. As Boomy mentioned, we're right here in the great state of Texas. I'm in Dallas and she's in San Antonio. The Healthcare Fraud Division is actually modeled after the special investigations units that are run by most commercial private healthcare insurers. If you're not familiar with these units, they leverage the skills of multidisciplinary teams to identify and prevent fraud through data mining, analysis of medical claims, review of medical records, review of business rules, and reports to law enforcement when warranted. Our division currently consists of myself. I have an assistant special agent in charge, a senior special agent, an investigative analyst, a healthcare auditor, a healthcare statistician, and our nurse consultant, Ms. Bumi Bamadeli. And we are also very fortunate to have a position for a special prosecutor to be detailed to VA OIG from the Department of Justice, specifically designated to prosecute criminal VA OIG healthcare fraud cases. Our division is essentially what I have dubbed a healthcare fraud supergroup, being that once we're fully aligned, we will be able to combine investigative expertise, healthcare audit experience, the legal support through the special prosecutor position, clinical experience, and advanced data analytics support to not just our investigative personnel within VA OIG, but the healthcare fraud investigation community as a whole.
The National Healthcare Anti-Fraud Association estimates conservatively that healthcare costs the nation about $68 billion annually, about 3% of the nation's $2.26 trillion in healthcare spending. The FBI estimates losses could be as high as 10% per year or $3 billion. The majority of the healthcare fraud is committed by a small number of dishonest healthcare providers, and in some particularly distressing cases, by individuals only posing as a legitimate healthcare providers. Sadly, the action of this deceitful field ultimately served to tarnish the reputation of perhaps the most trusted and respected members of the societies, which is our medical doctors. On this slide, we have our fraud trend indicator toolkit and crime alert SharePoint with the website information. Selecting the fraud indicator toolkit and crime alert with the red flag on the right-hand side of the page brings you to our fraud indicator toolkit, which we'll be explaining furthermore down the line. It is essential to recognize potential fraud indicators within our community in order to protect our personal health information from the fraudster targeting the veterans and the most vulnerable. The veterans community should be aware of the above in order to report suspicious activities and alleged misconduct to the Office of Inspector General. For this presentation, we're going to be focusing on fraud indicators associated with the healthcare fraud involving VA paid community healthcare providers and vendors. The first example is that of unsolicited contact offering free or low medical supplies, equipment without medical necessity. An example of this would be that of durable medical equipment. You may receive a call indicating that you qualify for a free back or knee braces, totally free at no cost to you. However, what they don't tell you is that your Medicare insurance will be billed without your consent. They even pretend to be from Medicare or even from the maker of the DME equipment, which is the durable medical equipment, and ask you to verify your information, such as Medicare information, Medicare number, or your personal health care record information, including your primary care physician's information. In some cases, you receive the equipment and they bill your insurance without your knowledge, and in some cases, you don't even receive those equipment. Another example is that of genetic testing. You may be approached at a pack or even receive a call indicating Medicare covers cancer screening just with a swipe of your saliva at no cost. However, they bill Medicare without your consent and without you even knowing until you receive your explanation of benefit. They use diagnoses such as cancer as a scare tactic for individuals to cooperate with them. It is very essential for you to review your explanation of benefits every time you receive this in the mail to make sure that the services rendered is actually appropriate. Another example would be offering free or discounted items or services to patients. It could be free medical supplies. It could even be you receiving a call with someone offering house call services, which is at no cost to you. Trust me, there's nothing free about this because there might not be a cost to you directly in terms of copay. However, Medicare will be paying thousands of dollars for these services rendered, and it might be too late by the time you realize it. So it is very important that you do not share your personal health information or your Medicare number with anybody. Another example would be patients are being billed for items that appear excessive or even unrelated to treatment, or perhaps they were not even provided. A perfect example for this would be perhaps you went to see your primary care physician and you were treated for just a simple cough. Your doctor provided you with over-the-counter medication. And by the time you received your explanation of benefits in the mail, it indicated that you were being billed for pneumonia and pneumonia diagnosis, and also perhaps a chest x-ray was done. Again, I cannot emphasize enough the importance of taking notes when you go to your doctor's office. Make sure you record every single services that were rendered and who provided the services for you. This way you can always cross-check on your explanation of benefits. And again, if you feel like something is not right or there's a discrepancy, call your healthcare provider for clarification.
Thank you, Bumi. I'll cover the next three potential healthcare fraud indicators. If you have items delivered to your home that require a physician certification, such as orthotic braces, the genetic testing kits that a lot of people have been receiving lately, or prescription drugs that you have no medical need for, more than likely the supply of these items is fraudulent. VA OIG and our investigative partners, we have investigated many cases recently in which patient information was sold to medical supply companies, labs, pharmacies, all in order for them to bill millions of dollars worth of medically unnecessary items. The fraudulent companies use several tactics to obtain patient information. Boomy touched on some of them, but I'll just add that they resort to telemarketing. Social media ads are on the rise. And I've even seen individual recruiters contact individuals door to door or at community events, always offering free services or items. As Boomy indicated, be leery of those things. They may not be at a cost to you directly, but they're certainly not free. Once these individuals have your identifiers, they basically have a blank check to sell to other providers to bill your insurance. Again, we encourage you to safeguard this information and report when you receive items that you do not need, especially when they were not ordered by your doctor. I've encountered several healthcare beneficiaries during my work where they have boxes of items that they've received, testing strips, orthotic braces, even motorized wheelchairs that that they don't need, and they're in a closet, they're in a back room. Please make sure that you're reporting when you're receiving these items that were not ordered by your doctor that you don't need. A common indicator of fraud in the healthcare arena that we've seen recently is a lack of prior relationship between a patient and the medical provider ordering the services. When we're reviewing claims data, because as I mentioned before, we are using data analytics to drive a lot of our work, that's one of the things we're looking for. When we see a patient receiving services with no prior relationship from a physician, that's an indicator to us that there may be some fraudulent activity afoot. Fraudsters are aware of this, so they are likely to contact your primary care physician with hopes of obtaining approval for medical devices or services in order to avoid scrutiny of their claims. Unfortunately, if that falls through, some bad providers will result in actually paying physicians for their signature, or they'll resort to creating false documents. In one of the cases I worked, the cooperating defendant, she shared with us that they engaged in what they called arts and crafts. She explained that they literally cut the signature off of documents that were actually signed by a physician. They would tape it to a blank document, photocopy that document, all in efforts to make it appear that the doctor had signed the document. Other times, she explained, they would place a signed document behind a blank one, hold both of them up to a window, and trace the physician's signature to make it appear as it was signed. And I've actually seized some of these arts and crafts projects while executing search warrants. And so I have witnessed this firsthand, and it's truly astonishing the lengths that people will go to commit fraud. A very practical and often overlooked way to identify fraud such as this is by reviewing your explanation of benefits or your EOBs. Those are the documents that you receive from your healthcare insurers that detail the services billed on your behalf each month. If you identify a charge for services or supplies that you did not receive or from a provider that you're not familiar with, please make sure that you call your provider's office to inquire about the charge, or you have the option to report it to your insurance carrier's fraud hotline. It could be a mistake. However, I can't tell you how many investigations have actually been launched based off of such information.
In addition to what we've been discussing, provider identity theft is also a big one. Believe it or not, healthcare providers, especially the new doctors, have their NPI information compromised. Their NPI information is the unique number issued to each medical providers for billing purposes and also for services to be rendered. And their information are being used for services such as DME equipment for authorization without their knowledge. Again, I cannot emphasize the importance of reading your EOBs, the explanation of benefit, as we've been discussing, to ensure the services rendered are provided, and when in doubt, reach out to your provider to clarify any discrepancy. Again, take notes during your doctor's visit so that you can have a recollection of services rendered. Another fraud indicator is lab or procedures are being spread out for higher reimbursement. We refer to this as split billing. An example would be you going to your physician's office for your annual examination checkup. On the same day, the doctor recommended that you have your blood drawn by the phlebotomist in his office. However, when you receive your explanation of benefits in the mail, detailing services that were offered to you, you see that your annual visit was billed for, say, the first of the month, and then the labs that were drawn on the same day were dated for, say, 2 days later. Again, this is usually providers well, the fraudulent providers would do this just for higher reimbursement from the government. Another one that I know that has been on a rampage recently is the genetic testing for duplicate billing. I will use myself as an example. I'm actually pregnant, and recently I had a genetic test done for my unborn child, and the phlebotomist came over to my house, drew my blood, and 2 weeks later I was notified that the result was inconclusive. And so they offered to come back the second time to have the blood redrawn, which I declined. And I said I will go to the doctor's office to have the blood drawn. That way, there's no issue with the next set of data set, right, from the lab. And I did have the repeat done at the doctor's office. And you would not believe that I did get a bill in the mail for the inconclusive test. And I also got an explanation of benefit for the second lab that was drawn at the provider's office. The insurance paid for the second lab, but they did not pay for the initial inconclusive test. On the bill that was sent to me from the lab directly, they offered me a good deal that anybody will have jumped at. They offered if I could pay $300 out of, say, $1,000 that was owed, that I'll be forgiven the rest of the payment. And now I started to think about it. If your services really cost over $1,000, why would you want to give me, say, about $900 off? Right? So I called the lab and I said, just looking at the bill that was sent to me, I see that you put me down as a self-pay, and the reason why they did that is because they've already submitted the payment to the insurance, which was denied. So the tactic they were using was putting me down as a self-pay, like I don't have an insurance, so that I can just quickly pay the $300 and say, oh, I got a good deal, right? So I called them, went over what the issue was, and the agent said, oh, ma'am, I'm gonna put you on a hold for a little minute. Came back, he said, ma'am, I'm so sorry. That was a system error. Now, whether that was a system error or not, I wouldn't know. Again, if I wasn't familiar with all these healthcare fraud indicators, I wouldn't know. I would have just gone ahead, paid $300, and think I got a good deal. So again, like I said, it is very, very important to double check services that are rendered to you. Make sure you're not double billed, because all these fraudsters are doing this in order to get higher reimbursement from the government or from your insurance company. Back to you, Letitia.
Thank you, Boomy, and thank you for sharing that. And we're so glad you're here with us today, as we know that baby Boomy will be here any day now. So we're so glad that you were able to join us today.
Likewise.
I'll cover the last four healthcare fraud indicators that we have from VA OIG. Upcoding. Upcoding is, as it sounds, it's simply billing for a more expensive service or item than what was provided. This was a huge problem here in Texas a few years ago with the power scooters being billed when motorized wheelchairs were actually being provided. When motorized wheelchairs were actually being billed, but the power scooters were being provided. At one point, you couldn't turn your head without seeing someone on one of those power scooters. Another area that we see that more recently is with telemedicine visits. As you can imagine, those services are reimbursed on the amount of time that a provider spends with the patient, and the longer amount of time spent with the patient, the higher reimbursement. So that's another area that we are seeing an uptick as far as upcoding. Unbundling. That's simply billing for each step of a procedure as if they are separate procedures. We commonly see that with laboratory services. In the healthcare fraud world, we refer to gifts or money offered for patients to sign up for healthcare services or to be referred to a provider for healthcare services as kickbacks. Now, kickbacks appear in different forms. In my investigations, I've seen it as outright cash exchange between healthcare providers and Medicare beneficiaries or veterans. Also, cash between providers and marketers or to referring physicians. I've even seen it disguised as a in contracts as a salary, for a quote unquote medical director. And one one of the strangest cases that I've worked. I've actually seen Medicare beneficiaries that were issued cell phones in exchange for allowing their healthcare benefits to be billed for services. This was for a home health case of all things. But the intent, regardless of the form that the kickback is in, the intent is always the same, and that's to cause fraudulent payments from healthcare insurers. And now I'm going to turn things back over to Boomi to discuss some of the healthcare fraud trends that we've seen in 2022.
According to the National Healthcare Anti-Fraud Association Healthcare Fraud Trends Report for 2022, the top 3 highest fraud trends that we have at number 1 is the DME frauds at 24.3%. Again, like we've covered, this could consist of ordering unnecessarily durable medical equipment like the scooters, the braces that we've discussed. It could be even be diabetic supplies being ordered and shipped to your house without request or knowledge. And in some cases, you don't even receive this equipment. At second is fraud relating to medical fraud, medical doctor fraud, which is at 20.9%. Telehealth services fraud was at its peak during COVID-19. Providers were billing for services not rendered and indicating that it was a telehealth services services. Another example that we saw in regards to medical doctor fraud trend is that of illegal opioids being distributed across the state to vulnerable opioid addicted patients, and they're billing this patient a hefty amount of payment for the opioids illegally. Thirdly, fraud relating to services and supplies not provided is at 19.3%. Billing for services not rendered is a huge factor in this.
Thank you, Boomi. Now I'm going to spend some time talking about some of the recent fraud alerts that we've issued here at VA OIG. But before I do that, I wanted to share some information about our community care program. In fiscal year 2022, the estimated cost of services rendered through our community care program, and this is the program, as I mentioned earlier, that we contract with community-based providers to provide care to our veterans and their family members, which is very similar to the Medicare and the Medicaid programs. The estimated cost for services rendered through this program was over $23 billion just for fiscal year 2022. And while the majority of the Healthcare Fraud Division's efforts involve identifying and investigating fraud, given the amount of expenditures for this program, preventing fraud and protecting our veterans is equally as important. To that end, we have committed ourselves to sharing the latest information on fraud schemes that affect the veteran population in order to protect this critical benefit. In addition to developing content for the Fraud Indicators Toolkit, we've developed these fraud alerts. The fraud alerts have been distributed not only to veterans themselves, but also to Veterans Health Administration or VHA personnel and our VA OIG personnel, and also to over 200 veteran service organizations and their membership. The first alert in this series was developed in response to receiving complaints from our VA physicians alleging contact by laboratories requesting approval for costly genetic testing that they did not order for their patients. This was coupled with threats of legal action for refusal to comply with signing the request. We developed this alert to assist our VA clinicians and our veterans themselves with identifying red flags related to genetic testing fraud. Those include the clinicians receiving unsolicited faxes or calls from labs to certify tests that they did not order, and veterans receiving testing kits in the mail that were not prescribed by their assigned VA physician. The alert also includes information on this scheme that was published by our partner agency, HHS OIG, as this is a prevailing fraud scheme not only with veterans, but also among the Medicare population as well. And you can access this fraud alert along with our Fraud Indicators Toolkit on our website, as Boomi indicated earlier. Now, home health, that's an area that has been particularly vulnerable for fraud. From my experience with the Medicare program, and unfortunately, it's the same here within the VA's healthcare delivery programs. If you recall from the top fraud trends slide that Boomi shared a little bit earlier, home health providers were amongst the list of top fraudulent providers for 2022. And to that end, we've received some recent complaints to our fraud hotline from veterans and their family members, alleging that home health agencies were billing them for services that were not provided as indicated on their EOBs. And that was the catalyst for our second fraud alert. Remember what we shared about EOBs, and I know we've mentioned this several times, but it's very important. It could be an error, or you may think that you're the only one that has been billed improperly, but many cases have been developed by individuals monitoring their EOBs and reporting services that they did not receive. For this particular alert, we not only encourage veterans to review their EOBs, plugging that again, but we also provided guidance on understanding the EOBs that are issued by VA's healthcare delivery programs, which are very similar to those issued by Medicare, but somewhat different. So we wanted to make sure we provided specific guidance. And with that, I'm now going to turn things over to Bumi to share how you can report information to our VA OIG hotline.
Thank you, Letitia. We encourage you to, for everyone here today, to be the voice in reporting veterans' wrongdoing. Do not hesitate to contact us if you witness any wrongdoing, such as crimes and violations of regulations and rules and regulations, mismanagement of gross waste of fund, abuse of authority, and risks to patient, employees, and property. We can be reached via our telephone number at 1-800-488-8244 or through the fax at 202-495-5861. Or you could reach us through the mail at VA Inspector General Hotline. Address is 810 Vermont Avenue, Northwest Washington, D.C. 20420. Or you could even scan the QR code as indicated on the right side of the screen for the VA OIG hotline. To keep up to date on fraud-related enforcement action, all things related to VA OIG, you may follow us on social media, on Twitter, LinkedIn, or at Veterans Affairs OIG, or at Department of Veterans Office of Inspector General, and our Veterans Oversight podcast. Recent posts include case highlights, our fraud alert, and link to episode 87 of our Veterans Oversight Now podcast, featuring Letitia Cleveland, sharing additional information about our career in fraud investigations and other healthcare fraud divisions. Now we'd like to open up the floor for any questions that you may have. Thank you very much for having us this morning.
Yes, thank you. And in addition to our fraud hotline information, we also wanted to provide our contact information. You can certainly obtain it through Texas SMP as well.
Absolutely. Thank you both so much for that information. This was a lot of really good information, but one thing I just want to say, I'm kind of floored at how brazen and just bold some of these scammers are with the way that they go about, doing this. Like, it's almost like they have no fear of getting caught.
No, that's a fair assessment.
It's really scary. But I think this is great information. And honestly, this is one thing, I know at the SMP, we always are trying to encourage people, look at your EOBs, look at your, your Medicare statement, your statement from VA, review those, because that's generally how we're going to catch, these people, stealing from the government. Yes. So that's I just want to say that one again and reconfirm that, like, people look at your EOBs seriously. And Bumi, congratulations on your new little one coming on the way.
Thank you.
Yeah, thank you. Congratulations on that. We do have a question here. So first question, being scammed can be very embarrassing for individuals. Is there any way that we can, what can we do to fight the stigma for victims, to make them feel less ashamed about coming forward and sharing what's happened to them?
Do you want me to take that, Letitia?
Oh, by all means, go ahead.
Okay, so as discussed earlier, one of our values is actually to protect individuals who are alleged wrongdoing and to treat them with respect and dignity. And also we meet the highest standard of integrity, professionalism, and accountability. We're very, very, very big on privacy. If you come forward reporting any allegations, we're not gonna put all your information out there for people to know, like, hey, say John Doe is the one that came forward with this allegation. We're gonna treat you with respect. We're gonna respect your privacy. And you know, we're here to support you. At the end of the day, we work for you guys. You know, we work for you guys. So privacy is a very big thing on our end. And you know, professionalism and also respecting you as an individual, so that we can always encourage you to come back and report any wrongdoing that you may see in the future. So Letitia, would you like to add anything to that?
I think you stated very well. I'll just add that just in my experience being a field investigator and interacting with veterans and Medicare beneficiaries during that vulnerable time when I'm bringing to their attention that they may have been a victim of one of these scams, I know that that's a particular scary place to be in, and there's concerns for confidentiality, and that's something that we dealt with quite often. And I can say for the federal agencies across the board and state agencies included that we are very big on protecting confidentiality, and that information won't be disclosed. We have laws in place to protect your information. However, in the event that a case goes to trial, there may be a situation where you may be asked to provide additional information and be a part of the investigation outside of your initial report. But we are very intentional about working with you and preparing you for that experience, all with the ultimate goal on making sure that we're not only protecting you, but also the program that's funding your healthcare benefits. So, and one of the things that all federal agencies are really big on, I can speak specifically for VA OIG and HHS OIG, is outreach and community outreach. And that's one of the reasons why we were excited to partner with Texas SMP today for this event, because we want you to see a face and know that it's a safe place and a safe space outside of just seeing our hotline number or our flyers. So we're hoping that this kind of helps bridge that gap for helping more people to step forward and report when they've been a victim or think that they might. Like I said, it could be an error, but many a case has been launched based off of someone just being diligent about their EOB and like, I don't know that doctor, or I didn't receive that item. Many a case has been launched that way. And so we encourage people to step forward.
I think that's super important that you touched on that. And I think sometimes people kind of go through this battle, like, is this big enough for me to call them? Is this important enough for, for me to call them to make that step? It's like, should I call or should I just, whatever. I think sometimes, people have that kind of internal struggle before they actually call. But yes, so you're saying that if something even a little bit just doesn't seem quite right, that it's okay to call. And if it's not a problem, then great. If it wasn't fraud, then great. But it's better it's better to be safe than sorry.
Mm-hmm.
I think.
Correct.
Okay. Another question here. How many reports does the VA get about fraudulent activity? And is it typically from the victim themselves or from a family member or an outside source?
It's thousands, I can say, and probably triple that on the Medicare side, having worked with HHS. And one of my jobs was actually to review the complaint, so I can speak to that personally. But focusing on the VA, we receive thousands of complaints from veterans, their family members, caregivers, things of that nature. And there was a second part to your question. I want to make sure that I address it.
Is it typically the victims or the family members of the victims or an outside source that sends those reports in?
Yes, I would say the veterans themselves, their family members, caregivers, and actually the VA clinicians as well. As I mentioned, sparked one of our fraud alerts as we were getting calls from the VA physicians themselves that were like, my patient doesn't need this genetic testing and I didn't order it. And there's a problem here. And so it comes from all sources.
Now, you did talk about, and I think Bumi also talked about, that people will be treated with respect if they have unfortunately found themselves in a position to where they, have become a victim of fraud. People still sometimes might not feel comfortable coming, forward. Can reports be made anonymously? Oh, I'm sorry. I think you actually kind of touched on that it can be, anonymously, and eventually they may need to share the information, possibly if, it turns into a major case. I think you did actually
Correct.
kind of touch on that a little
Correct.
bit.
And we do get a ton of anonymous complaints. And I can just tell you, just with any line of work, when you don't have a source to go to, it makes it somewhat challenging. We prefer to be able to go to the victim themselves to get specific information. For example, like with the upcoding allegations, we would need to know, well, who did you see? How long did you spend with the doctor? And if we don't have a person to go, if we just get a complaint, for example, that says, uh, the doctor billed me for something I didn't, it's vague and we're not able to get the details. So while we do accept anonymous complaints and we do provide confidentiality, it is nice for us to be able to have a source to go back to obtain that additional specific information. Nobody's going to be able to speak to that better than the individual that experienced the issue themselves.
For
But they do
sure.
have that option to report it anonymously.
Okay, for sure. Another question here. Does the VA ever release the findings of an investigation to the public? Like, do we ever get to hear, the results of such investigations?
Most definitely. We shared our website information, our social media. We are big on sharing information about our criminal and civil investigations. There, pretty much daily, you'll be able to see the results of our investigative work.
And this is just a quick, just off the top of my head, I was just thinking back, hearing all week long, we've been talking about consumer protections and things. So it kind of makes me kind of reflect on some things that I've experienced or have seen. And I did have a cousin, he was receiving VA benefits. And I just, and this was a long time ago and it was in another state, but I just remember receiving bills after he passed. We got bills. And I just was wondering, does that happen often? And of course, at the time I was like, wait, I of course followed up on those, but do you see that often, or does that happen? And people should stay diligent even after they may have lost the loved one who was receiving benefits.
Well,
Correct.
it is strange that you mentioned that, Dorian, and Boomy and I are both, because we are actually working on a proactive project specifically focused on that. Veterans being billed for services after their date of death. That is something through our data analytics capabilities that we've identified as a problem as well. So it's happening too often. And in speaking with VA leadership, because we're a separate independent oversight entity of the VA, that is something that they are aware of as well. So we're combining forces to address that. But unfortunately, that is something that does occur, and we are taking steps toward addressing that. Trying to determine, again, is it an error? Could it be
Oh,
that
yeah.
maybe a provider has a veteran on an auto pay, like there's a service that they receive quite often? Or is it intentional? They know that the veteran has passed away and that they did not provide the services. So that's what my team is focusing on right now, identifying where we have those scenarios and then trying to determine, is it truly fraudulent or is it more of a systemic administrative issue that we need to address? But unfortunately, that's something that's occurring too often.
Yeah, this was a long time ago, but I immediately saw that and I was like, wait a minute. There's no money, no way we're going to pay this, but
Well, it's still happening, just so that you know, up to today.
wow. So yeah, so consumers stay vigilant and continue to monitor anything that you receive in the mail for someone that has passed away as well. So this was really, really good information. Letitia and Boomy, thank you so much for sharing this information with us today, helping us to feel more empowered and more comfortable about calling. So everyone, you hear it here. If you have any, oh wait. We still have a few more moments. So actually, we have another question, if you don't mind. Let's go
Sure.
with how do you distribute your anti-fraud literature? which is
Yes, we have partnered with the VA in order to distribute specifically the fraud indicators toolkit and the fraud alerts. And of course, we're doing that through our website. It's available there as we shared during our presentation, but we're also making sure that it's distributed to the local VA campuses. When veterans visit the VA facilities, they're able to see our fraud alerts on the monitors when you're in the waiting rooms and in other common areas of the VA facilities. We've also made sure to distribute it to all of our personnel, because if you've noticed, some of our alerts are not just focused on the veterans, but also our employees as well, specifically our clinicians and some of the things that they need to be aware of. So we were intentional about getting that information on the VA campuses as well. And it's also distributed to them via email, but we also wanted it kind of like a looming reminder there on the campus. And then we also work with several of the veteran service organizations to distribute our anti-fraud literature as well.
good information. Absolutely. Yeah, I think that's a good idea, having it up on the screens. I think so often too, you just get comfortable with, seeing certain things. And I think repeating this information and bringing it to the forefront of people's minds, I think will help us get ahead of some of this fraud. So
sure.
Let me check. Did anyone else in the comments, any participants have any other questions? You can go ahead and type those into the chat, and we'll try to get those answered before we close out here. Just okay. Well, we're not going to hold you. Again, thank you so much. This has been great. Information, empowering information. And I think that's ultimately you all, the SMP, and all the speakers that we've had all week. Ultimately, we want to help empower consumers. And I hope that everyone, there were some takeaways that you might be able to utilize. So thank you so much. We appreciate everyone joining in, and we actually have one more. This is the last day for our National Consumer Protections Week. We have one more presentation this afternoon at 1 o'clock. So join us again, and thank you so much. Y'all have a great day.
Great.
Thank you for having us.
Thank you.
Take care, everyone.